In this video, I'm going to go over easy sciatica pain relief exercises for seniors. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy sciatica pain relief exercises with seniors in mind. So very straightforward, simple movements. A note about these exercises, each one works just a little bit differently. Each one is going to target a different cause of sciatica, including bulging or herniated disc, causing a pinched nerve, spinal stenosis, and piriformis syndrome. To get the best results, go through them all. Use what gives you the most relief. With that being said, let's get started. So before we start, let's go over an important thing that we're going to be looking for during these exercises, and that is called centralization. In a nutshell, the biggest cause of sciatica is due to a pinched nerve from a bulging disc or a herniated disc. The more pressure being put onto those nerve roots, the more pain goes down the leg. What we want to focus on doing is taking pressure off that nerve, and when that happens, the pain starts to come back up or centralize towards the lower back. So as you do these, if you see the pain lessen and come back up the leg, that's a good sign. What we don't want to see is pain going further down the leg, and if that's the case, you want to back off slightly from these exercises. So let's start with a couple easy exercises that you can do standing that are going to help address the biggest cause of sciatica, again, that bulging or herniated disc, putting pressure on a nerve. So the first one is called back extension. Very, very easy to do. We're just going to start standing with very good upright posture. Have your body and back as straight as possible. You're going to take your thumbs and you're going to place them right above the belt line. Just press right into the muscles right off to the side of the spine. We're not going to press directly over the spine. You want to just press in there gently and maintain that. From there, what we're going to do is keep our lower body, our hips right here and pelvis locked, and we're just going to bend backward with our upper body, so taking our shoulders backward like this. The more that you go backward, the more it puts it into extension, the lower back that is, and you should feel a deep stretch form over the lower back. Only go to the point where it is a comfortable stretch. If you feel any more of that pain going down, again, back off slightly. At that point, you want to hold this position for 30 seconds and do nice, slow, controlled breathing. Let out as much tension as you can. From there, relax. If it felt like it worked out pretty well, pretty good, you can throw in a couple more repetitions. And with each repetition, try to build into it just a little bit more. If you want to take this one to the next level, what you do is just go up a level. So take your thumbs and slightly go above. You're going to notice it hits the back just a little bit differently. The nice thing is you can start to pinpoint areas that just need a little bit more attention. So I would start right at the belt line area, work up a little bit, and any spot that you find just gives you the most relief, stop over that spot, and then do this for about 3 to 5 repetitions. This is a nice exercise that you can do throughout the day. So the next one is called a Walling exercise, and this one is probably one of my favorite exercises to do. For this, we just need a door frame or a wall. The hardest part about this exercise is knowing what side to put towards the wall or the door. So remember, good door, that is good or non-painful side towards the door. So I'm going to demonstrate what to do if you have right-sided sciatica. So I'm going to put my feet together slightly spaced away from the door of the wall, roughly about a foot, and then I'm just going to lean my body weight, my upper body weight, into that wall or the door. The key is don't have any space between your shoulder and elbow. So you don't want it to look like this, because if we do this, we're just going to get an arm workout. So just treat that kind of like a suction cup stuck to that wall or the door. From there, you're just going to take your hand, place it on the other side's hip, and gently press that hip towards the door. As you do this, you're going to feel a very good stretch form on that painful side. Only go to the point where it's comfortable and you start to see that centralization. The key with this exercise is it's going to take pressure off that side and press it towards the center. So if you have a bulging disc off to the side, it's going to really help bring it back off that pinched nerve and hopefully get some pain relief. Again, hold this one for 30 seconds and do nice, slow, controlled breathing. From there, just relax a little bit bit, and try to repeat this one 3 to 5 times. And with each repetition, try to build into it just a little bit more. If you want to take this one to the next level, space your feet further away from the wall or the door so you can lean a little bit more into it. It'll be a lot deeper stretch, but only to your comfort level. This sciatica relief exercise is called the standing puppy, and I really like this one. Not only is it going to help with bulging and herniated discs, but it can also help with another main cause of sciatica, which is spinal stenosis. It's going to focus on a deep pulling motion in the lower back to open up joint spaces and also relieve pressure off pinched nerves. For this one, we need to go next to a wall or a door. So you're going to start facing that door roughly about 1 arm length away. You want your legs roughly hip width apart, and you're going to place all of your body weight onto your heels during this exercise. It makes it a little bit easier to do. From there, your arms are going to go right in front of you, hands overhead, and you're just going to lean your body weight into the door. What we want to do from here is just tuck our chin slightly towards our chest, use our fingers to crawl up just a little bit until you feel an initial stretch in your back, and then from there, pretty straightforward. You're going to bend your knees and then squat your bottom down and away from the door. Just do this one nice and slowly. As you go down, the more intense this stretch will be felt. You'll probably feel it in the upper back working down into the middle to finally the lower back. We really want to focus on feeling it in the lower back. Go down really, really slowly until you feel that deep stretch in the lower back. Once we feel that, we're now going to hold this comfortably for 30 seconds and do nice, slow, controlled breathing. Just let out as much tension as you can. If you want to make this one a little bit more intense, what you can do is crawl with your fingers upward just a little bit and also allow your chest to sag forward towards the door just a little bit. It will, again, intensify it just a little bit more. From there, you're just going to relax, take a breather, and then repeat this one 3 to 5 times. And with each repetition, try to build into it just a little bit more. So if you want to take this one to the next level, what you can do as you do this exercise is do a slight rotation with your hips, just side to side like this. It will help open up the back just a little bit more. I would build into this one very, very slowly. You might find that only one side, like rotating towards your left, offers you relief, but if you go towards the other side, it might cause pain. So again, with these ones, you only want to build into movements that are offering relief, especially that centralization. You can also do a leaning motion with your hips. So instead of kind of like a turning motion like this, just rock your hips from side to side, going from left to right. Again, you might find that one certain position, maybe this time around just kind of leaning it towards the right, just offers a little bit more relief. So give that a try, and if you find any movement that offers a little bit more relief, try to do that for about 10 to 15 repetitions. So if you want to take this one to even the next level, as you do this lean, instead of keeping your body straight, tilt it towards one side. So kind of move through your waist, tilt your upper body towards one side. I'm going a little bit towards my left, and then repeat this. You're going to notice it opens up the back just a little bit differently. So give that a try towards the left. You can also go towards the right. If any of those spots offer a little bit more relief, hold that for about 30 seconds and throw in an additional 3 to 5 repetitions. Another cause of sciatic-like pain comes from a muscle called the piriformis, lies right underneath the glutes. When this muscle becomes strained and inflamed, it can cause a compression injury known as piriformis syndrome. Tends to come about from too much sitting, so think a lot of desk work, taking a long car ride, plane trips, something like that. If you sit for long periods and that pain just builds and just shoots down the back of your leg right here, give this exercise a try. This one is known as the pigeon pose or the figure 4. It's going to help lengthen, but more importantly, strengthen that muscle and get quick and long-lasting relief. Let's just lie flat on our back like this, in bed or on a floor. Whatever side that you're having pain, let's say it's your right side, you're going to start off by bending your knees, keeping your feet flat, and taking the painful side's ankle and placing it over the other side's knee. So when you look down, it should look like a figure 4. What you want to do is slide the leg right here that's supporting our top leg backward like this as much as we can so our heel is coming back towards our bottom. From there, you're going to take the bent knee on top right here and just slowly press it away from you. Do not use your hands to do this. What you want to do is make the glutes right here start to fire and work for it. So the more that you press that knee away from you, the more that you're going to feel a lot of muscles around the hip, including the glutes and the piriformis, start to fire. You only want to go to a point where it is comfortable, not causing any discomfort. If that's the case, back off slightly like this. But you're going to hold this position right here for 5 seconds. You're going to relax, and then you're going to repeat this 10 to 15 times, and with each repetition, try to build into it just a little bit more. If it feels like you have a little bit more energy, you can always throw in another set or two. And there's no problem doing this on both sides. In fact, I would recommend doing this on both sides, even if the other one doesn't hurt, just to keep everything in balance. So another really good way to strengthen the piriformis is to do what is known as the glute bridge. It's really important that we strengthen these muscles to make sure that they don't cause issues later on. So for this one, we're going to get back into our original position, lying flat on our back, knees bent, feet flat. And what we're going to do this time around is tighten our core muscles. It's kind of like taking your belly button towards your spine, bracing your core, and then we're going to squeeze the glutes. From there, you can take your hands, put them on your hips or off to your side for support. You want to just slowly lift your hips upward towards the ceiling until your body is in a nice straight line from your knees to your hips to your shoulders. If you have difficulty doing this, either due to pain or weakness, go up as far as you feel comfortable, but stop before the point of pain. But over time, hopefully you will gain strength and flexibility, or you just won't have the pain anymore to be able to get into this nice straight position. In this position, you're going to feel a ton of muscles start to fire, the core, lower back, but more importantly, the glutes and that piriformis. You want to hold this comfortably for 5 seconds. You're going to relax, and then you're going to repeat this one 5 to 10 times. And with each repetition, try to build into it just a little bit more. And if it feels like you have a little bit more energy, you can always throw in another set or two. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.